Good afternoon. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. I'm joined by Dr. Geraldine Luna, Medical Director at CDPH, to give our weekly COVID-19 data update. First of all, the travel advisory continues to apply to the whole country. For the 7th consecutive week, all U.S. states and territories continue to be at a high-risk case level, as defined by CDC, greater than 15 cases per 100,000. There is a sign of hope that Maryland is the first state that we're seeing dropping below that mark. So if they are still below there next week, they'll be the first state to come off the advisory. And I wanted to just highlight that given the delay in vaccination ability for children under 5, the travel advisory no longer applies to children under the age of 5. In addition, it is an advisory, not an order, as you know, but we know that there have been daycare settings and others that have been using this, and can be a big burden on families. So as long as everybody who is traveling with the child, the adults who are traveling, are fully vaccinated, the child themselves does not have to be. Where we look in a little more detail at that matrix, we do see that there are parts of the country that are having a lot more trouble. Darker purple always means worse. And if you've been following this along week after week, this is looking so much better than it was just a few weeks ago. You see that really in Appalachia right now is having some of the worst case rates, but you can see in the Northeast and across the Midwest and here in Chicago, those lighter colors mean a receding of COVID case numbers, and generally good news. If we look a little more specifically in Illinois, again, the lighter numbers mean lower case rates per 100,000 population. You see Chicago is really doing very well compared to the rest of the state, and Illinois is doing very well compared to the rest of the country. Nationally, we're averaging 47 cases per 100,000 per day. Illinois is at 34 per 100,000 per day. Chicago's at 16. What's our goal? First goal is getting under 15, so we're very close, but that would be moving out of the high-risk status really as defined by CDC, and I'll remind you of what that means in a minute. On the Chicago dashboard, chi.gov/COVID-, everything is heading the right direction. We're averaging 431 cases per day right now. You can see that's 15.9 cases per 100,000. And as we drop under that 400 cases per day, that's when we move from high into the substantial or moderate risk as defined by CDC. So that's down 30% from a week ago, even in a week where tests are up 17%. So that is a real decline and making excellent progress. We're still averaging 30 Chicagoans newly being admitted to the hospital with COVID every day, and between 8 and 9 Chicagoans dying every day of COVID. Still, both of those are double where we were prior to Omicron, but improving. And our test positivity, given that testing is up and cases are down, is down to 2%. So what does all this mean? I know there's a lot of conversation about masks and timing, and I want to remind you of the metrics that we're using, that we've been using, and that we continue to use. We are getting close. Certainly, we're watching the end of the month, as I know the state is, and here's the progress, and here's where we are. So on our community transmission and risk matrix, just a reminder, we've been using this same public risk matrix week after week after week. These are the four main metrics we follow publicly: cases, positivity, hospital beds, and ICU beds. And you see that our cases remain in the high transmission. Again, this is as defined by CDC, but we're getting very close to substantial there. You can see at 431, as we drop under 400, we'll move into substantial. I think that may happen as soon as today. Test positivity is down at the lower transmission in blue. We want all the numbers in blue or green in an ideal state of the world here. And hospital beds are in yellow, heading toward blue, and ICU are in yellow, very close to blue, 115. And actually, I just checked the dashboard and it was 107 today. So I expect that we will see ICU probably move into that lower transmission in the next day or two. I expect just a little behind that to see the non-ICU capacity, assuming that we continue to see progress, and then cases may lag a little bit further behind that. As we said, we need 3 of those 4 metrics to be in at least the lower transmission space and be there. And so given the progress we've been making, I am feeling very optimistic. If we look at the progress we've made, it's pretty remarkable. December 28th, we had more than 10,000 cases diagnosed in the city of Chicago. So to be down to 431 is beautiful progress, but it is still relatively high risk. Test positivity on January 2 peaked at 20.2%. So it is good to be at 2%. We had 1,615 hospital beds just here in Chicago filled with COVID, the most we had at any point to date in Chicago with COVID. The great majority of those folks unvaccinated. That was the setting in which we had to put the vaccination requirement in for high-risk settings, for example. So to be at 376 now is good improvement. And then our ICU peaked out at just under 400, and then to now be down to 115 is good progress. And I also just showed how quickly we were seeing things moving here to let you know, yes, we're getting close. So the last day we were in that very high transmission. The red for cases was January 31, and just about 2 weeks later, we're almost out of orange. Test positivity, the last time we were in red was January 17. Last day we were in orange was January 23rd. Last day we were in yellow was January 26th, and we're all the way down to blue. You see the last day we were in orange was January 31 for hospital capacity, and then January 16 for ICU. So everything is moving as expected. And certainly if the difference is the matter of a few days between where the city is and what the state is recommending, I would expect we would go along with that, but we need to see these metrics be in blue or green. So I think next week we will probably, hopefully, be able to share some good news and make a final determination. But please know, we're watching the data, and that is all based on risk levels. And I did want to just remind you about what these risk levels mean. These are not pulled out of the air, made up. They have to do with the risk that you are going to be exposed to somebody with COVID-19 right now in the city of Chicago. So we are making great progress, but COVID is not over. At the current case rates, pulled this today off of the biosci risk that Georgia Tech runs. The current case rates in Chicago, there is still an estimated 45% chance, a 1 in 2 chance, that at a 50-person gathering right now, there's going to be at least one COVID-19 positive individual. Now, if that's a highly vaccinated setting and everybody's masked and there's mitigation in place, it doesn't mean there will be transmission, but it means that there's probably somebody there. Ideally, somebody who doesn't know it, because hopefully if they're sick, they're staying home. And at a 100-person event right now in Chicago, there's a 69% chance that somebody there will have COVID-19, even if they don't know it. And at a 500-person event, there's basically a 100% chance. Now, this is an estimate across, all areas of Chicago, and depending on the ascertainment that you use, it would range between 36% and 50%. But this is the default. And so I want people to understand that when we're talking about lifting masks, when we're talking about lifting mitigations, it's about getting down to a point where the risk of it being exposed to somebody who currently has COVID-19 and could be spreading COVID-19 is relatively low. And that's why we do what we do, and why we use the data, and why we've been consistent with what the epidemiologists and CDC have been recommending. More good news. You see Pedro Martinez was not able to join today, but I am bringing some of the CPS data because I know there's interest. So as expected, in line with City of Chicago data, COVID-19 cases in CPS school buildings continue to decline, although they too still remain above pre-Omicron levels. So you can see each of those bars, the light blue is the students and the dark blue is the staff. These are all cases that are diagnosed and were present at all in a school building. And you can see a 60% decrease last week compared to just 2 weeks ago, and a big decrease from that. And so just as we have expected all along here, the case rates that we see in our schools, whether that's CPS, whether that's the Archdiocese, whether that's daycares, they reflect what we see in the city of Chicago. We do not see being in school adding significant additional risk, but they are also not no-risk settings. And that, particularly where they are less vaccinated, is one of the reasons why masks at the moment do remain in place in those settings as well. Also at CPS, making beautiful progress on testing. I did an event with parents last night, and they were asking, is there good testing available? Yes, there is lots and lots of testing available every school continues to have testing, and they're breaking records every week for how many tests are being done in CPS. You can see the week that this last week, the 6th through the 12th, 64,439 tests at CPS, screening tests, the most they've ever done by about 10,000. And in that setting, the positivity is down to 0.45%. Now remember, these are screening tests, meaning these are not people who have symptoms. It's not a surprise that that percent positivity would be quite a bit lower than the cities, but you can see that the decrease has been similar. And if you go back to over winter break, not a lot of testing was happening, but still the positivity was about 19%. And if you go back just a couple of weeks, you know, it was in the 2.5% range, and now it's back down well under 1%. So all very much in line there with good progress. And that positivity is the lowest it's been since early November. So again, really as Omicron started to take off. Overall at CPS, there's been a total of 1.9% positivity, and this last week 0.45%. So doing well. And compared to the other large school districts we also follow, we are right in line there. Los Angeles had a 1.3% screening test positivity last week. New York City had a 0.35%. So nothing unexpected here. Not seeing a large number of outbreaks. That's true across both public schools and non-public schools and daycare settings. So we are making good progress, but again, not over yet. I want to really emphasize a little bit about early treatments that remain available. I've been saying this each week, but when we talk to doctors in Chicago, we are still hearing that high-risk people who get COVID, people who are over 65, people who have underlying conditions, they get COVID, they're vaccinated perhaps, they don't call their doctor, they don't do anything about it, and then a week or two later, sometimes they start to get really sick. And it is too late, a week or two later, to get the early treatments that are available. There are oral treatments, there are IV medications, and if you test positive, regardless of your vaccination status, you can get these medications, and we want you to call your doctor. The number one reason that our Chicago providers say people aren't getting these is that they're hearing too late. And so I want to remind you, you can't just walk into a pharmacy and get this. There's a lot of interactions. The doctor has to make the recommendation, or the healthcare provider. But all individuals over the age of 65, by definition, are eligible for these treatments. So please call. They are provided by the federal government at no cost. So even if you are uninsured, you should call. The federally qualified health centers here in Chicago are all set up. We've been working with them. They will get you hooked up with these treatments if it's appropriate for your situation. And they're available in Chicago. So please do call if you have an underlying condition, you're over 65, better safe than sorry. Your doctor may say, no, there's not a need for you to get this, but if there is, we want you to get this. This is the second part, along with vaccination, that can help keep you out of the hospital. And the other good news is that vaccines continue to work beautifully, especially against severe COVID outcomes. Chicago infection rates are declining. During the Omicron surge, age-adjusted COVID infection rates 3 times greater in unvaccinated Chicagoans compared to vaccinated and boosted Chicagoans. So, I still have not been diagnosed with COVID, despite the fact that I've been out and about and doing a whole lot of things. Might I be at some point? I might be, but my vaccination and my booster have continued to serve me well with the other mitigation measures. Chicago hospitalization rates, even more importantly, are declining, and this is where the vaccine really has shown its worth. Just during Omicron, just in Chicago, unvaccinated Chicagoans 10 times as likely in an age-adjusted way to be hospitalized compared to vaccinated and boosted Chicagoans, and then deaths 30 times as likely to die in an age-adjusted analysis for Chicagoans who are unvaccinated compared to vaccinated or boosted. And this is regardless of whether people had COVID in the past, okay? So whether you had COVID in the past, vaccinated, unvaccinated, doesn't matter. This is straight up, did you get a vaccine? Age adjusted, 30 times less likely to die if you've been vaccinated, boosted. So please do so, even right now, while things are improving. The good news is our vaccination rate does continue to increase. You see each of those lines, those are the different age vaccines. Every single week, they are going up, they are going up, they are going up. And we do continue to add about 0.5% to 1% of vaccination each week. 76% of all Chicagoans of all ages have now had at least one dose, and 68% are fully vaxxed. And 81% of eligible Chicagoans, meaning those over 5, have had at least their first dose, and 73% fully vaxxed. I'm pleased about that second number in particular. I'd like to get to a point where 75% at least of the city is fully vaxxed, and at least 80%, have had that first dose. Those are numbers that are being used a lot nationally, but we are doing well, and every single day, thousands of Chicagoans still getting their first vaccine doses. The vaccination rate by age in our children is also doing quite well compared to the national average, although again, one of my bigger concerns about schools is how much less vaccinated children are. So the good news is that we are approaching 50% of 5 to 11-year-olds and 80% of 12 to 17-year-olds in Chicago who have gotten that first dose of COVID-19 vaccine. And that's good because the 50% here compares to about 31% across the country, and the almost 80% here compares to about 2/3, 67% across the country. But still, that is a much less vaccinated setting, and we worry knowing that vaccine is the most important thing if you're going to choose among all the mitigation measures to help prevent the spread of COVID and to help prevent more serious outcomes. It's one of the reasons why I think schools continue to have some extra focus for mitigations, and we want to make sure they stay open. We've also hit an important benchmark that 60% of Black non-Latinx Chicagoans have now had at least that first dose of COVID vaccine, 54% fully vaccinated. This remains a major focus of the Chicago Department of Public Health and our partners. We have seen Black Chicagoans get hit the hardest in the Omicron wave in terms of hospitalizations and deaths, and this is the leading reason for that. I continue to address a lot of misinformation that spreads on social media, and I would just ask, if you have not been vaccinated, regardless of your age, your race, ethnicity, if it's for something that you read on social, please do ask a healthcare provider about that. Come to the Chicago Department of Public Health, give us a call. We'd be happy to make sure you have the right information. But we're making good progress here. I also wanted to just give a vaccine update for the children under 5. So as you've likely heard, the FDA and Pfizer have decided to delay the authorization for children under 5. That's because the FDA wants to review the data for all 3 doses of the vaccine for young kids instead of just starting with 2. Now, why is that? The young child size dose that was used in the trial here is really tiny. It's 1/10 of the adult size dose. So remember, 5 to 11-year-olds get about 1/3 of the dose of adults, and for these little ones, they did 1/10 of the dose. So that was beautiful from a no safety concerns at all, not having problems with side effects. But honestly, that really low dose for the 2 to 4-year-olds didn't quite give the efficacy or the protection that they were expecting. And so they're expecting after the 3rd dose to see the amount of immune protection that you would want from the vaccine. But they made the decision, I think particularly with the Omicron coming down, to wait, to make sure that when we recommend a vaccine, it is not only safe but effective. So they are anticipating that data will be available in early April, but it does mean it's going to be a number of months for children under 5 to be able to get a vaccine. And I know that's disappointing for people. Again, this is why we've exempted kids under 5 from that travel advisory, just knowing that we are waiting and, but we want to make sure that the vaccines are safe and effective at the time that they are approved. I also just wanted to highlight that as the COVID surge is starting to recede here in Chicago, we have this beautiful workforce through the Chicago Cook Workforce Partnership and a lot of the agencies on the south and west sides, almost 600 Chicagoans who have been sort of catch-all, amazing contact tracers, and they're the folks answering the call at the call center, and they're doing outgoing calls and canvassing. And so as we've seen some of the demand for contact tracing decrease and some of the calls decrease at the call center, we've got teams out again. So thanks to the vaccine ambassadors, they're out again, door to door, particularly in Chatham, South Shore, Roseland, and Englewood. They are dressed like that, so you'll know them, and they're there to answer your questions, get you set up for a vaccine, make sure you know about treatments that are available, help connect you to care as needed. Just make sure that in the communities that we continue to see hit the hardest, we're doing everything we can to make sure that the right information is getting out. And I did just want to highlight, we have plenty of appointments available for the family vaccine clinics that CDPH is doing with city colleges. This Saturday, we're at Kennedy King. This Sunday, we're at Olive Harvey. Free, widely available, kids, adults, boosters, etc. And CPS continues to have just dozens and dozens of vaccination opportunities. This is from their website, Tuesday, Wednesday, Thursday of this week, in addition to the 24 school-based health centers where you can make an appointment. All of these clinics at these elementary and high schools are open to members of the CPS community, including parents, guardians, et cetera. They've done more than 700 of these sort of pop-up clinics in addition to the routine. So doing well there, and that continues to be an area of focus. And finally, at home, still going well. We are still going 7 days a week there. We're seeing good demand. We've been expanding capacity, particularly on the south side. And so there are appointments available 8 a.m. to 6:30 p.m., Monday through Sunday. You give us a call, free. No identification, no insurance, no questions asked. There is the $50 incentive, not for boosters, but for primary or secondary doses. But we're happy to bring you a booster if you didn't get one of those yet. And we'll do up to 10 people at the same time. We are the only large city in the country that does this. And part of the reason we've doubled down on it is because we have seen the biggest uptake of this program among Black Chicagoans and in some of the least vaccinated areas of Chicago. And recognizing that we most want to get rid of barriers in areas where rates remain lower. It's something we have continued to put additional resources in. So as a final reminder, you need a vaccine, you want a booster, you have questions, testing, whatever, chi.gov/COVIDVax, or just give us a call, 312-746-4835. The Community COVID Corps are answering the phone. They're there 7 days a week. Thanks so much, and I will hand it to Dr. Luna for some comments in Spanish, and then we'll take your questions.
Muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. ¡Feliz martes! Y hoy les vengo a traer, para comenzar, las últimas actualizaciones de la ciudad. Y de todo, quiero mencionar que todos los estados y territorios de los Estados Unidos están en el aviso de viaje de la ciudad. Así que si están planeando viajar, acuérdense, evitarlo si no están vacunados. Aun cuando estemos llegando al final de este repunte, todavía los casos están en transmisión alta. Estamos satisfechos con el progreso que estamos logrando en la ciudad. A raíz del aumento de Omicron, ahora vemos el descenso y nos alienta el plan informado por el Estado de levantar su mandato de uso de máscaras para finales del 28 de febrero. Si nosotros como ciudad continuamos viendo estas disminuciones en las métricas que andan liderando nuestras decisiones aquí de la ciudad, también deberíamos estar en condiciones para levantar esas restricciones cuando sea el momento. Pero lo más importante es que sea de manera segura. Cuando la ciudad haga su transición, es posible que muchos habitantes de Chicago continúen usando máscara en los espacios públicos por una variedad de razones, incluso si están vacunados. Y los mandatos y avisos poco a poco se irán desvaneciéndose de acuerdo al riesgo del sitio donde estaremos levantando esas restricciones. Alguien puede estar inmunocomprometido, preferir usar su máscara o tener un familiar que esté inmunocomprometido o ser demasiado jóvenes y no todavía ser elegible para recibir la vacuna. Ahora, aquí hay una actualización de dónde estamos en la ciudad con respecto a las tasas de vacunación. Y es importante mencionar esto porque este es el momento de vacunarnos y todavía no lo hemos hecho, para tratar de lograr esa inmunización de grupo ahora cuando los casos vienen bajando. Entonces nos estaríamos enfrentando otra vez a las mutaciones que podrían seguir subiendo y otra vez no queremos volver a pasar por estos intermedios que tantas vidas ha costado. 3/4 de los habitantes de Chicago han recibido al menos una dosis de la vacuna. Y eso nos alegra mucho, pero nos acercamos a 50% de los niños de 5 a 11 años que han recibido por lo menos una tasa de la vacuna. Pero recuerden, los latinos tenemos la cantidad de niños mayor en este rango. Así que es importante vacunarnos. Mucho camino que recorrer todavía, pero estamos optimistas. El 76.4% de la población asiática en Chicago está completamente vacunada, nos debe servir de estándar, y el 53.6% de la población afroamericana. El 65% de la población latina está completamente vacunada y el 70.3% de la población caucásica está completamente vacunada. Todas las personas mayores de 65 años, escúcheme bien, son elegibles para recibir, pueden ser elegibles para recibir los tratamientos contra el COVID-19 temprano en la enfermedad. Y estamos hablando de los medicamentos orales e intravenosos. La única manera de saber si usted es candidato para elegir este medicamento que le puede salvar la vida es llamando a su médico o su casa hogar médica para preguntar de la elegibilidad. Y es importante porque es sensible al tiempo. Solamente tiene 5 días para poder recibir este tratamiento oral que podría ser la diferencia entre morir o vivir. Si da positivo al COVID-19, le recomendamos que inmediatamente se comunique con su proveedor. Ahora, una actualización sobre la vacuna para los niños menores de 5 años. Y sabemos que hay una gran decepción porque queríamos proteger a nuestros niños de menos de 5 años. La FDA y Pfizer acaban de anunciar un retraso en la autorización de la vacuna para niños de menores de 5 años, y esto es porque están revisando la data de la protección que ofrecería una tercera vacuna contra el COVID-19 para este grupo etario. Estos datos deberían estar disponibles ya a principios de abril, así que con más razón, por favor, todos los que sean elegibles para recibir la vacuna, vamos a vacunarnos para proteger a nuestros niños. Solo un recordatorio, tenemos muchas citas disponibles para las clínicas de vacunas familiares para este fin de semana. Si quiere más información, puede llamarnos donde un humano le hable en español en la cultura que entiende al 312-746-4835, o para aquellas personas que tengan acceso a la internet es chai.gov/COVID-Vax. Haga su cita, vaya en familia, vacunen a nuestras abuelitas y recuerden que la vacunación sigue siendo el arma más poderosa para combatir esta pandemia. Además, nuestro cuerpo comunitario de respuesta al COVID continúa con los esfuerzos de captación. Seguimos viendo nuestros embajadores tocando puerta a puerta. Tenemos también nuestros promotores de la salud para hacer esas preguntas. ¿Qué le falta para accesar, para bajar y disminuir barreras que puedan estar impidiendo que nuestra comunidad reciba estos servicios tan críticos para sobrevivir la pandemia? Y por último, como siempre, un recordatorio para aprovechar nuestro programa de Protege a Chicago al Hogar, donde sin costo adicional, sin necesidad de una identificación gubernamental o aseguranza, puede recibir la vacuna en la comodidad de su hogar, vacunando hasta 10 personas por vez, completamente gratis y recibiendo incentivos de hasta $50 por vacuna con una serie primaria de hasta $100. Así que le pedimos que por favor, y los incentivos funcionan, que haga esa cita. Las citas están disponibles de lunes a domingo, 7 días a la semana, de 8 de la mañana a 6:30. Y sabemos que nuestros latinos han utilizado pobremente este recurso con solamente 20%. Es tiempo de subir las defensas. Vamos a terminar de esta pandemia y vamos a hacerlo en forma segura. Gracias.
Questions. We got mics on both sides here, so several people here. If you can limit it to one and a follow-up, and please identify yourself, that would be great.
Wonderful. Good afternoon, Dr. Arwady. Michelle Gallardo with ABC7 here. I know it's impossible to put a date on reaching certain metrics, right? But if you look at where we are now, where we need to be, all things being equal, going on the trajectory that we are, does it appear that the city will be pretty much on the same timeline-ish as the rest of the state, or do we think it is likely people might have to wait a little bit longer? What are your guesstimates?
So that's what I was trying to give people a sense of with the data here. You know, I want to be clear that we have to get to these metrics. That's just what has gotten us this far. But the progress that we've been making, that's what I was saying. We need 3 of the 4 to get there. I'm pretty confident we're going to see a second one in there in a day or two, and probably a third one a few days after that. And I had said, actually, even before, those of you who have been following along, even a few months ago, I was saying, the spring looks like we'd maybe be able to do this, and as things were moving faster, could it be before? I had actually shared internally with the team here, even before the governor had sort of mentioned the end of the month, that I was feeling pretty confident that, around the end of the month, the beginning of March, we would probably realistically be in a place where we'd be able to be announcing the lifting of some of that. I will be honest with you, we are going to hit, we need to hit those metrics to feel confident. And I want people to understand that we're not just choosing a date, we're going based on when we're there. But as I said, if the difference is a few days to help not have people be confused and have things be straightforward, my expectation is we would be able to go along with that. So I think next week, when we stand up and we look at where things are, we'll be able to give a more definitive answer around that. But I think things are generally looking very good. And I want to thank Chicagoans who, we're ahead of the state, really, where you look at the state overall. And that's in terms, we're one of the highest for vaccination. We're doing a good job wearing masks. Like, sticking tight right now is what helps those numbers come down faster, and helps us get to a point where we can drop some of the requirements, which I, like everybody else, am really excited to be in a place to be able to do.
Hello, I'm Mariano Giles with Division Chicago. I have a couple of questions. You've said that citywide, 38% of kids between 5 and 11 years old have been fully vaccinated, but according to Chuck Bid this morning, in CPS, the same bracket has only been vaccinated about at 22%. And we know that 90% of the kids in CPS schools are Black and Latinos. Where do you think the message failed when it was sent, when talking to these two communities?
Yeah, so I'm not going to comment on the 22%. I don't have those numbers exactly in front of me. I do know that maybe I'm not sure of the distinction there. I know that generally CPS has been a little bit closer. They are lower. CPS is lower than the city average, as would be expected, given the demographics. For both the older kids, the teenagers, and the younger kids, I know we're actually closer on the younger kids than we are on the older kids. So I'm not sure exactly the date that we were looking at there. And last I looked, CPS was more similar to the national average, whereas as a city, we're kind of above it. So I definitely don't want to give the impression that we are sort of failing there. In fact, it's one of the areas where I think there's the most promise to continue to work. And that's why, our vaccine ambassadors have been working with their vaccine sort of confidence teams and, really building up at the school level to make sure that where you can have these conversations about how to keep a school safe, how to keep a school open, and ideally have parents in there. But there is a very wide range of vaccination within CPS and across schools in this city, where I'm looking at a school that's, 75%, 80%, 90% vaccinated. That's not a school I have a lot of concern about. When I'm looking at a school that's, 20% vaccinated, that's going to be a school that is just higher risk for COVID. And so as we do move ahead here, it is one of the pieces we're watching the most closely. But I really, those CPS sites continue to be sites where there are hundreds of people getting vaccinated, just like there are at our city clinics. And I think it's one of the spaces that will continue to work in the most. But I'm actually reasonably pleased with where we are.
In the light of that, I know you talked about it, but maybe you can remind us why was never a good idea to issue a vaccination mandate for CPS?
So related to vaccination requirements for CPS, we only did a short-term vaccination requirement here for high-risk settings, right? The restaurants, the bars, the entertainment events where people are having to take off masks to eat and drink, et cetera. And that really has been in this time period because we were seeing our hospitals get hit so hard, and recognizing that people who are unvaccinated were the ones filling up the hospital, needing to do what we can to help not have those higher risk settings be even higher. But schools are not high risk settings, right, for COVID spread. We've known that. They have a lot of the mitigations in place. I wish all the restaurants had the all the mitigations in place that schools do. So I would say right now, the vaccinations also, they remain under emergency use authorization. I fully expect they will get the full FDA approval, but they haven't yet. And we know that there are people who want to wait for that full approval, and I respect that. And I think the conversation, we're going to see a little bit, I think, where we are over the summer and heading into fall. There's certainly a history of requiring certain vaccinations for schools. And it's all going to depend, I think, on how we're doing as a country. But I always prefer people to choose vaccines out of confidence. And we certainly have seen a lot of parents doing that. And then the other thing for vaccination in school settings is that if your child is vaccinated, they don't need to quarantine when there are cases in schools. And given the disruption that we've seen, I hope that is something parents and guardians are really hearing. Because for me, that's one of the biggest ones, that my child could stay in school even if there is a child who ends up having COVID, in the classroom with them, as long as they remain asymptomatic.
So just to clarify, I thought there had to be two, I'm sorry, Marianne Ahern, NBC.
Yeah.
So is the requirement still 2 weeks for 3 of the 4 metrics before you can lift the mask?
So 3 of the 4 metrics is a definite. I would prefer to see those be there for a full incubation period, but I also know that it can be confusing if there's a difference of a few days, for example. And so we're going to see where we are next week and make a decision sort of either way there. If we are not able to move on the 28th, I think it would probably be not very long after that. But if it's a difference of just a few days, I don't think it's worth the potential confusion to the public. But if we're talking about a week difference, for example, we might extend it. We've got to hit the data points.
And is that a CDC requirement? Why 2 weeks?
Oh, well, typically you want to see an incubation period hold. That's what we will generally use all along. And again, those metrics, particularly the case and the positivity, those are based on CDC metrics, right? Like that's what they're using. And I think one of the reasons here is that we have seen such a nice quick decline here, that assuming that is continuing and we can sort of project out, I feel less like the 2 weeks is an absolute requirement, like it sometimes was earlier when things were up and down and where were they, et cetera. So I think, I'm not comfortable moving, and I don't think it's appropriate to move if you haven't hit 3 of those 4 metrics. But if the difference is a little bit in that incubation period, as long as the trajectory looks good and we're not seeing signs of trouble, I think we would likely be able, to move ahead. But we'll know that for sure, because we'll know what the data is showing us next week.
Good afternoon, Amy Jacobson, WIND. So you had mentioned this, the number 400. We're stuck on the number 400. But what metrics have to be in place to unmask kids at school, since Pedro Martinez has said that he's relying on your advice and counsel for that?
So just as a reminder, schools, are regulated at the state level. So just as the governor has said, they're aiming for February 28th. He's said that schools, that the mask will remain in schools. At this point, I think that has to do with the lower vaccination rates, with the fact that, we do see kids with underlying conditions in schools. And I know there's been a lot of attention to it, but we really would look to the state, as we have all along, for the requirements around schools.
Okay, and then as you know, because you've pointed out tens of thousands of people had COVID recently, how long should they wait before they get a booster shot or a vaccinated? And why isn't natural immunity part of this conversation? Because in Europe, if you've had COVID, that counts as 1 vaccination shot. So why don't we have that here, and why is it lost?
Yeah, a couple things on that. So first of all, there is no need to wait after having had COVID to get a booster shot or a first shot or a second shot. There is no need to wait. You need to be out of that 10-day period where you could potentially be infectious. So if you just got diagnosed, you got to wait 10 days. But other than that, you can get a vaccine right away. That is also true, by the way, for people who got treated with monoclonal antibodies, any other treatment. You do not need to wait to get the vaccine. So on question 1. And on question 2 about natural immunity. So we certainly look at what we call the serology rates, like, here in Chicago, what percentage of across Illinois do we see of people who have previously had COVID? But what we've seen, particularly with the Omicron variant, is that prior COVID infection had very little protection against Omicron, much less than it had against prior variants. And so the reason that I share that sort of vaccination, unvaccination, that doesn't take into account whether or not somebody has previously had COVID. I do think, we've seen all along the very best protection out there is people who have both recovered from a natural COVID infection and who have had a COVID vaccine. That is the best protection. Below that are people who are vaccinated. Below that are people who have just recovered but not had a vaccine. I remain the most concerned about the people who have neither had COVID nor had a vaccine. But the concern is that I don't want people thinking I should try to get COVID to get that protection, given that we do see people sometimes, it's always not always predictable who gets seriously ill from that. And so we certainly don't ignore natural immunity. And I tell people if they've had COVID and had a vaccine, they've now got the best protection out there. But it is not in the studies. It's just not a substitute for the higher level of protection that vaccines give.
Hi, Heather Sharon, WTTW. I'm going to get a little bit wonky for you. A devoted watcher of your Ask Dr. Arwady segment, you have said up until this point that the furthest out, the highest metric is the one that determines the city's overall risk. So like if cases are at a substantial risk, then why wouldn't you would consider the entire city at the substantial risk? That sounds like it's changing now with your saying that we just need 3 of 4 risks in that lower transmission to take off the masks and remove the vaccine mandate. Why the change?
Yeah, so let me clarify a little bit. I think there's 2 different things there. So CDC, sometimes I'm talking about the CDC recommendations, and the CDC has a case and a positivity, and it is the higher one that always takes precedence there. So that's typically when we refer to it, that's typically when I'm referring to sort of the CDC point. But then the CDC metrics, as you know, match our Chicago numbers just corrected for our population. All along, if you look back to when we've lifted it previously, we've followed these main metrics. At some other points, we had emergency departments and some other things in there, which we still follow behind the scenes. And we have used sometimes slightly different in terms of what needs to be where. But I'll tell you, particularly on the cases, which is the one that I expect will be the last to come down, we are in a really different place from case numbers, and we see that because of positivity. So for me, if the case numbers get down to that substantial risk, but positivity is in green, there's sort of like you're testing so much more that you're detecting more cases. And so those two sort of correct each other a little bit, I think practically when you look at this. We do a lot of testing in Chicago, a lot more than is done in many, many, many parts of the state and the country. And so by definition, we have somewhat higher case rates and somewhat lower positivity rates. And so those are set kind of on purpose with each other. And that's why, we want to see the hospital numbers. That's always going to be the one we're the most concerned about, making sure we can come down. We're not stressing the healthcare system. We're at a good point, even expecting to see some rebound as we lift mitigations. But that's really the reason for it. And I want to make sure that we're evolving as the amount of testing changes.
So the last time you were before us, you presented data that showed that the vaccine mandate had really triggered an increase in vaccination, particularly among young adults. Why take off that requirement if it's been so successful in encouraging maybe some of the younger people who are more reluctant or made it less of a priority to do so? Yeah,
so the main goal of the vaccination requirement was and is to protect the hospitals. It really is at the end of the day. And knowing that it is the unvaccinated people that were filling up our hospitals to dramatic numbers, the highest we've seen yet in COVID, and knowing there were a lot of younger unvaccinated people among that, this was one of the measures. You know very well, we did not want to have to shut things down. We did not want to have to put restrictions back in place on restaurants, et cetera. Masking is, to my mind, the least intrusive of the things that we can do that limit risk, and then having a vaccination requirement only for high-risk settings is the second. And certainly I am pleased to see vaccination increase, but that sort of mitigation at the societal level is really just meant for times of significant surge and of when we can come back down. So, my hope is we would never need it again, but I will tell you, if we get a new variant in the future, we start to get into trouble, we start threatening the healthcare system, we start seeing those numbers be very up and high again, we would be following similar metrics, and we could have a mask recommendation and maybe even a mask requirement in the future. We could have a vaccination requirement for high-risk settings. I dearly hope not, but we'll continue to follow the data. So we won't require it because that has never been the main purpose of doing it.
Mary Gettinger with the Hyde Park Herald. I wanted to ask about, you said something, one really quick and one a little bit more in depth. You said something about federally qualified health centers now have access to like Paxlovid, if I heard you right.
Mm-hmm.
So, I mean, there's people who fall through the cracks with healthcare all the time, including some pretty sick people. If they get COVID, can I say, report, call Howard Brown, call Friend Health, call Near North. They have access to these early access pills now. That's something I can do.
Yeah, we've worked with the federally qualified health centers, the hospitals, et cetera. We most wanted to make sure that people in long-term care facilities, people who are getting cancer treatments, those very highest risk people, had access. And so making sure the oncology units and all of that sort of had it first. But it's been a few weeks. And, as there's been more availability, we also really wanted to make sure that the safety net providers were getting prioritized. And so depending on the federally qualified health center, some of them have wanted it available at the center. Some of them have preferred to work with a pharmacy. But we've been working a lot with all of those providers to make sure that if they've got someone who needs it, we can get them connected to it.
Cool, that's the story. Second of all, I'm wondering if you can speak more about this kind of age-adjusted issue with the studies on mortality and hospitalization. You can talk about what I've heard a lot from people in the community, especially, entirely, immunocompromised and elderly people looking ahead to the later parts of the pandemic, as time goes on. As masks come off, people are concerned about what that means for them, as people will continue to get sick, even if they are vaccinated and that kind of thing. So I'm curious what age-adjusted means, because I know that, there are still people who are elderly, even though they are vaccinated, who are getting quite sick, being hospitalized, in some cases even dying.
Yeah, absolutely. So age-adjusted, it's a standard epi procedure, and we actually have all the underlying data available through the data portal if people want to take a look at it. Yes, I will. But just so people know, we have both the crude and the age-adjusted. It basically means that the risk of hospitalization or death is lower for younger people than it is for older, but the difference is so much greater than at the younger level. And so it is true that older people will continue to be at higher risk for more severe COVID outcomes. That has been the biggest risk factor, except for immunocompromised from the beginning. It's one of the reasons why we've really tried to push vaccination and boosters and treatment availability for that older group. I think especially looking ahead, I want to keep folks out of the hospital. I want to keep folks from dying. Making sure that older people are not only vaccinated but accessing treatment, I think is going to be really important. But the whole point of when you lift mitigations is when at the societal level, that risk is lower. The chance that you're going to run into somebody with COVID is lower.
So, Dr. Roy, you said a few different times that kids, the school setting is the lowest risk setting. It's one of the lowest risk settings. And do you feel bad for teachers who for 2 years now, like you're up here at the lectern, you don't have a mask on, Governor Pritzker doesn't wear a mask, and the kids and the teacher, they're not connecting. And so the education is suffering. Is there any possibility maybe where teachers can take off their masks so that they can, if they're far away, because we're 6 feet away from you, and they can be 6 feet away from their students?
Yeah, so these are some of the conversations. These are some of the challenges. I'll tell you, I hear a lot from people who, of course, are anxious to have the masks off, as everybody is. I also hear a lot from parents who are concerned about their children with cystic fibrosis or underlying conditions and sort of what that can mean. And there have been some really well-documented examples in schools where, I think during Delta, there was a case example out of Chicago where there was an elementary school teacher who was attempting to distance and had taken the mask off to read to young children, as we do. You want expression. I understand sort of the need for that. But she turned out to have COVID, and then like half of the class ended up getting COVID, and they did the genomic sequencing and could see that it was linked to that. So I think the challenge is that it is a lower risk setting overall, but part of the reason it's lower risk is that there's been pretty good adherence to some of these mitigation measures. And so this is where, for me, if we can get to a place where vaccination rates are really high, right, that mitigation gets stronger, you don't need the masks as much, right? It's sort of this balance of all of the different mitigations. So, I've certainly seen some of the elementary children, elementary teachers, et cetera, there are these clear masks available that can have that are good for students who are hard of hearing, but also can be good for expression. And again, I don't think this is forever either, right? Like as we come down, as those are lower, I do think it's appropriate to also have them off. But when the risk is still where it is, I do worry about. I worry about the COVID situation even a little bit more than I do about the indirect effects, although they are there.